Good afternoon, everyone. I'm here on the behalf of Padma Shri Professor Dr. S. Natarajan sir. Since he is busy in his two back-to-back sessions, so he gave me this opportunity to present his topic. So, artificial intelligence is a branch of computer science that aims to answer Turing's question in the affirmative. Now, who is Turing's? Alan Turing's very famous computer scientist established the fundamental goal and vision of artificial intelligence. A machine that thinks like a human. Types of artificial intelligence. Narrow artificial intelligence, a weak AI like Siri, Google, and Amazon Alexa. Artificial general intelligence, strong AI. Skynet. Artificial intelligence enabling machines to think like humans. Machine learning. Training machines to get better at a task without explicit programming. Deep learning using multi-layered networks for machine learning. In ophthalmology, AI is seen to have unlimited potential to perform many tasks as well as or even much better than humans. It is seen to be very good as diagnostic tool, grade the severity of a disease, early disease detection, screening tool, prediction of the evolution of a disease. So here are some publications of artificial intelligence and OCT imaging. Artificial intelligence makes screening faster, more accurate, and more accessible, and AI and deep learning in ophthalmology. Published, this is a development and validation of deep learning published in JAMA. Problems of statement. The problem is with the lack of trained clinicians, delay, lost follow-ups, missed or postponed treatments, and increased in the probability of vision loss. Diabetic retinopathy screening is an important public health problem. Retinal photography is validated, simple, and effective for DR screening. Challenges. Diabetic retinopathy screening programs are challenged by issues related to implementation, availability, of human assessors and long-term financial sustainability. In order to overcome practical challenges like remote locations, transportation, and poverty, there is a need for improvement in the practical aspects of remote ophthalmic diagnosis and care. Recent studies indicate that AI has astounding potential to perform much better than human being in some tasks, especially in the image recognition field. Early detection and appropriate treatment of eye disease are of great significance to prevent vision loss and promote living qualities. Automated techniques of DR diagnosis have been explored to improve the management of patients with DR and alleviate social burden. AI was used to predict DR risk and DR progression among diabetic patients to combat with the worldwide disease. AI-based retinal screening devices. Smartphone-based retinal imaging is an efficient and cost-effective method for screening. The device can help in delivering eye care services to unprivileged population groups in resource-limited or remote areas. It is an ideal platform for comprehensive telemedicine-enabled eye health screening and detailed photo documentation for disease indications such as cataract, glaucoma, vitreous, and retinal pathologies. AI has the potential to significantly enhance and impact on screening programs for vision impairment and eye disease, and thus to impact on global blindness. Integration of retinal photography and AI. AI-based grading and diagnosis system for referable DR, glaucoma, and age-related macular degeneration cataract performs the following procedure fully automatically: identifies fundus features, classify image quality, classifies the existence and severity of the disease. Process flow. Screening can be performed using portable equipment which is easy to set up and effectively examine the eyes. In the screening process, diabetics can assemble in a community setting and technician can transport the screener to a particular location. The retinal image will be acquired using smartphone-based imaging devices by a semi-skilled worker who is specially trained for the same. The images are then graded by AI and a provisional report is generated. The cases with referable DR can then be referred to an ophthalmologist for further management. AI is based on deep learning technology. It can be used to detect referable case of diabetic retinopathy. Advantages: increased accessibility of screening program, low resource areas, enable non-eye trained clinician to conduct opportunistic screening without the need for trained specialists, saving of the health system for providing more targeted referrals to eye specialists. Real-time reporting of results and referable recommendation reduces the patient anxiety, reduces documentation errors, reduces difficulties recontacting patients. Remedio funders on phones can be mounted on switchable bike for transporting for screening purpose. It is a chargeable, portability is there, low maintenance and job opportunity, easy retrieval of data at reading centers. Accountability, proper training of a semi-skilled worker and proper and regular monitoring, ease of workflow, easy retrieval of data at reading center, uploading of diagnosis by retina specialist, treatment and general advice, regular intervals visiting of screening team for follow-up. Expected outcome, early detection and treatment after screening can reduce the prevalence of DR even in remote areas. Reduction in the economic burden among poor and illiterate people. Opportunity for semi-skilled workers also. It will help to improve overall health of the population. Grading by artificial intelligence. The Meteor's AI algorithm is designed to diagnose only referable DR and no diabetic retinopathy and does not grade the stages of DR. Referable DR was defined by the presence of moderate to severe NPDR, PDR, and of diabetic macular edema and clinically significant macular edema. Diagnostic accuracy of community-based diabetic retinopathy screening with an AI system. This was a prospective cross-sectional study took place on August 2018 to September 2018. Patients with diabetic mellitus who visited various dispensaries administered by the Municipal Corporation of Greater Mumbai on a particular day were included, published in JAMA. Known case of DM visiting the municipal dispensaries of Mumbai were included. Fundus images of both the eyes were taken and uploaded and saved on cloud storage space. An ophthalmologist seated in a distant location sees the image and grades the severity of the retinopathy. The AI incorporated in the cameras was also used to grade if the retinopathy was referable. Advantages. An offline AI algorithm does automated grading of the retinal images, providing the results immediately. Reports can be made readily available to patients even in the remotest location. It is moving. Advanced image processing capabilities, moving actually. Yes, sir, that's what. Escape it. It's okay. Diagnostic accuracy of community-based diabetic retinopathy screening with an offline AI system on a smartphone. I'll just tell the advantages of AI. Accuracy of the about 90% according to the initial pilots, which improves as additional data sets are gathered. Highly scalable process with thick response time. Solution is extensible. Emerging healthcare technologies focus on reducing unnecessary visits to medical specialists, minimizing the overall cost of the treatment, and optimizing the number of patients seen by each doctors. Disadvantages: negative AI-based finding may give the patients a false sense of security about the totality of their ocular status. Emerging evidence from the Jocelyn Diabetes Center showing that DR lesion in the peripheral retina are highly predictive, of which patients will develop proliferative DR, the binding form of the disease. Community DR screening using funders on phone. So on 26 January 2019, Mega DR screening camp in Dharavi using 13 funders on phone devices organized by Aditya Jyot Foundation. Community DR screening using funders on phone. 649 diabetic patients were screened in Dharavi using funders on phone device. 53 were diagnosed to have DR. So conclusion of AI for screening is accessibility, affordability and efficiency of the service. Thank you so much.